Good morning, sweethearts. Today is Saturday, and our topic this week is trans health. So a lot of folks have already said some of the things that I was going to say, but I'll probably be repeating a little bit of what other people have said, because I know not everyone watches every video. So I have three topics I'm going to talk about today. I want to talk about binders, doctors, and mental health. I've got a list just in case so I don't get too lost. There's a few things on binders that are super important. First, actually wearing a binder that is a binder. It's really not healthy to bind with just anything around the house, or saran wrap, or duct tape, or an ace bandage. Those things can cause a lot of damage. You can break a rib. You can have lots of lung issues. I'll look for a video. I'll see if I can post it in the description below if I can find it, that Stefan showed to me of a trans guy who had been binding improperly and was having extreme lung issues to the point where he could barely make the video. So his video is a good example of what not to do. So important things around binders: when you put it on, you should be able to put it on without dislocating a shoulder or an elbow. Your back should not instantly hurt unless you have been binding for 5, 6, 7 years. You should be able to breathe and move and do things normally. It's always kind of scary to me when I hear folks in the Sweethearts group talking about how their boyfriend or partner, when he puts his binder on, can barely breathe, can barely move. That means his binder is too small. Even if you've measured and you've taken his measurements, put his measurements against what Underworks or whatever other company you're using for a binder says that they should be. If your guy puts the binder on and he can't breathe and he can't move, and after a couple hours it's unbearable, then he is not wearing the right size binder. From talking with Stefan and from doing some research myself, you really should be able to, your partner should be able to wear his binder for 8 to 10 hours without any large health issues. It's uncomfortable, but it shouldn't be uncomfortable to the point of pain. And remind your partner as well, nobody knows what size you're wearing except for you. So I know some people get caught up on, well, I'm a medium and so I can't wear a large. Nobody knows the size you're wearing except for you. And it's better for your partner to be healthy than for them to put themselves into a situation where they could really severely hurt themselves. The next topic that I want to talk about is doctors. And it's kind of like a larger thing around doctors. I really encourage people to look around for a doctor. If you live in a small town and that's your only option, then you kind of do what you have to do, or think about how far you're willing to drive. Stefan's been talking to a guy was talking to a guy who lives in a small town in Indiana who's driving here to Dayton to see a doctor because that's his best option. In his town there was only one option. The option wasn't great. He didn't like the guy. So you're not going to see your endo or your general practitioner very often while on T, so sometimes it's worth making that 2-hour drive for a doctor who is going to care about you, who's going to treat you well. It always makes me sad to see folks talking about their doctor who is just rude or mean or doesn't want to give them tea because they feel like they're not ready. So I would definitely encourage people to shop around. Also, I think I talked about this in the Trans Myth video, but you don't have to see an endocrinologist. If you have a really good general practitioner, they should be able to look at those blood results and see what's normal, what's not normal, and go from there. Sometimes you may, if you're seeing a GP, sometimes you may have to go see an endo if there's some level that's really strange and your GP can't figure out why. But in a general way, a general practitioner is going to be just fine for people. Also in the doctor section, it's really important for trans guys, as soon as you can, to get a histo, a full hysterectomy and a oophorectomy, because the longer you're on T, the higher chance you have of having complications related to still having your female parts. And there are a lot of doctors that are willing to do that surgery for you, and this kind of also stays in my doctor section. If there's something that you need to get done related to your health, don't be afraid to ask your doctor about if they're willing to code it as something different, if they're willing to kind of scoot around the rules a little bit in order to help you to get it covered, at least partially, by your insurance. There might be another procedure that costs the same amount that your doctor might be willing to code it as so that you can get help. For example, when Stefan first started seeing his psychologist, they wouldn't cover trans-related mental health things. So his father had just passed, so they coded it as grief. And he was able to not only talk about his dad, which he was doing anyway, but also to get the help that he needed around trans-related stuff. That leads me into the last thing that I want to talk about, which is mental health. I've seen a lot of people on the Facebook group who have talked about their partner believing that once they're on T, that it's a magical fix and everything will be okay. And if you have issues, if there are things you're struggling with, those things are still going to be there. And so starting T doesn't mean that you can stop seeing your psychologist or your psychiatrist. It doesn't necessarily mean that you can go off any mental health medication that you're on. So I just want to encourage you all as the partners, probably who are watching this, that if your guy's got some mental health issues, encourage him to keep seeing his psychologist or his psychiatrist, because T doesn't make those things go away. It can make them better if it's anxiety or depression that is related to being transgender and not being able to express his maleness out in the world. Those things can get better with being on T. You know, if it's a dysphoria-related anxiety, being on T can help if your guy's really dysphoric about his voice or about being perceived as a woman. Those things can be helped by T, but severe anxiety, severe depression, other severe mental health issues, or even not severe mental health issues, even just issues around family or issues around how your partner was raised, those things can rear their ugly head, and they don't necessarily get better on T. And all with trans health, I think it's important to have a good relationship with your doctor, to have a good relationship with your counselor, and if something weird comes up, don't be afraid to give your doctor a call. And hopefully you find a doctor that, if there are random health things that come up, that you can go see them. Tell your partner's doctor about yearly exams and whether those are necessary, or if the blood work that they're doing on a consistent basis is enough. That's kind of where Stefan's doctor is. He believes that Stefan doesn't need to have his yearly lady exams because his blood work keeps coming back fine. So if he sees any weirdness in the blood work, then he would want him to go ahead and do that. Also, breast exams are very important. One of the things that Stefan and I have found that I think I didn't know going into it is that with binding and with T, you can sometimes get lumps that are not cancerous, that are not anything to worry about, but it can be scary because he did find a lump, and I was nervous about it. I was hoping it was nothing, and it turned out to be nothing. But definitely, if your partner is not checking, they should be checking, and if they don't want to check, then you should check to make sure that there aren't any lumps, because it's really easy to assume when you're on T that everything that happens is T related, and sometimes it's not. So I think that's all I have to say. I hope everybody has a great week and a great weekend, and I will see you next week.